To test pain, use a sharp safety pin. Ask the patient if this sharp or dull, or when making compressions, does this feel the same as this? Apply the lightest pressure needed for the stimulus. To feel sharp, avoid heavy pricks that draw blood to prevent transmitting a bloodborne disease. Use two test tubes or cup filled with hot and cold water. Touch the skin of the patient and ask the patient to identify hot or cold. Touch the skin lightly, avoiding pressure. Ask the patient to respond whenever a touch is felt and compare one area with another. For the test of vibration, use a low pitched tuning fork. Tap it on the heel of your hand and place it firmly over a distal interphalangeal joint of the patient's finger. And then over the interphalangeal joint of the big toe. Ask what the patient feels. Grasp the patient's big toe, holding it between your thumb and index finger. Demonstrate up and down as you move the patient's toe. Place a familiar object such as coin or a pen in the patient's hand and ask the patient to tell what it is. Normally, a patient will manipulate it skillfully and identify it correctly. Test the ability to identify numbers with the blunt end of the pen or pencil. Draw a large number on the patient's palm. Touch a point on the patient's skin, then ask the patient to point to the place touched. Stimulate one side or stimulate corresponding areas on both sides of the body. Ask where the patients feel your touch. Test the abdominal reflex by lightly stroking each side of the abdomen above and below the umbilicus.